So treatment for TMJ at our clinic usually starts with the IFC machine on the jaw. So in most cases at our clinic, if you've seen the other videos, we use suction cups. We use sticky pads, put them on the jaw, 10 to 12 minutes. This will be the weirdest sensation you've ever felt. There's a weird tingling sometimes in your eye, in your teeth, and in your tongue. Once that's over, we'll go into the hands-on stuff. So I usually wear gloves, so we have latex and non-latex gloves. I get the patient to open up, see what's happening, and then close again. In this particular case, it's her right-hand side, so open the jaw a bit. We get in here with some ART on her jaw, bite down on my thumb, and then just relax. And then I open her up like this. And you can actually see she's in a little bit of pain when I'm getting in this right side of her jaw in there. So we work this over 2, 3, 4 minutes of that just to get it all loosened up. Now I need to warn you, the 3 worst things I do at the clinic are calf treatment, hip flexor treatment, and jaw treatment. This can be annoyingly painful, but it's only a couple minutes and we usually work through it with you. So after the IFC and the ART, most patients are gonna get a session of Shockwave. Now, Shockwave on the jaw is like nothing else we do in the clinic, so it's very, very low. We have a very specific machine with a very specific head that's for jaws. We go in there and break up some scar tissue. Most patients take the machine as light as it goes. Basically, there's a pneumatic gun with a bolt and a tube. It hits here, and the applicator hits that. I can barely feel that on my finger, but when it's in your jaw, you can feel it. So with the patient, in this particular case, I'll just get her to turn her head. You come in here, you start it up here, and you work the muscles over it. I always start super low, and then I can turn the number up to the patient's comfortable. It's whatever's good for them. Now we're gonna hit that about 600 to 800 times. If the patient tells me one spot's more sore than other, I'll get right into it and trying to hold it, move it around, and we work up like this. In 90% of jaw cases, I'll rotate the patient over all the way, and then we'll do the same thing on the other side. Just like I said earlier in the video, just to loosen up both sides. Once again, another 600 to 800, super light, and then usually they're good to go. We're gonna send them home with some exercises, including a couple jaw stretching stuff. And in this particular case, I would recommend they ice the outside of their jaw where we ran the Shockwave at least the same day of treatment. So to go over again, IFC first, hands-on with some ART, Shockwave the affected muscles of the jaw, go home, start your exercises. Even chronic cases get better at our clinic between 6 and 20 visits, depending how bad it is. But definitely the tracking will change and the pain will decrease after the first day. Okay, for TMJ patients, which we've noticed a neck component, there's a couple things we do. So one thing we're gonna do is activate the jaw, usually on the bad side. So if I get her to turn here, very simple, come in. This is a little bit of annoyance, but most people can fight through it. Now, when I've been palpating the neck, I can almost always guarantee there's a spot up top that we're gonna get to release. So very basic, turn the head and pump there. And then we get that upper joint to release, and almost guaranteed the first time the patient gets off the table, they'll be able to open their jaw more. They're gonna feel a release of pressure, and just almost like they had a tension headache inside their jaw, that pressure should be alleviated quite a bit. So basic activator on usually the bad jaw side, and then adjust the neck on the bad jaw side too, possibly the other side. And once again, we'll send them home with some stretches and get them back in probably later on in the week.